Hello everybody and welcome to the Thursday edition of Video Clips, and I've chosen as a topic for today insomnia because lots of people have it. It's estimated that 10 to 15% of American adults have chronic insomnia, and the rates are most likely higher in older people, people who have certain diseases or psychological disorders. A lot of medications can increase insomnia. People don't realize that, but I see it all the time when people come in here. They complain about sleep disorders and the medications they're taking actually cause them. Some common drugs that cause insomnia are drugs to treat hypertension, antidepressants, corticosteroids, antihistamines, and statin drugs, interestingly enough. Insomnia also can result from dealing with stresses in life, such as divorce, financial worries, or illness or death in the family. And usually it's a temporary thing, but sometimes it turns into a chronic thing if those problems are chronic as well. Chronic insomnia leads to a lot of problems, including daytime fatigue. It can make it very difficult to focus at a job, unsafe to drive a car, increased risk of depression, anxiety, substance abuse. So there are a lot of side effects of insomnia that are quite concerning. Lots of drugs, as you might imagine, are commonly used or recommended to treat insomnia. Benzodiazepines, or benzos, are one class of drugs approved by the FDA for the treatment of insomnia. And they work for a lot of people, but there are serious risks associated with taking them. All of them in this class of drugs are considered Schedule IV drugs, which means there's potential for both abuse and addiction. Additional side effects include impaired memory, increased irritability and impulsivity, and depression. Benzos shouldn't be taken by pregnant women and elderly people, and they are highly addictive. It can sometimes be more difficult to discontinue use of a benzo than it is to get off of a drug like heroin. Now, non-benzodiazepines, or non-BZDs, were developed as alternatives, and the selling feature was that they didn't have the same potential for abuse and addiction. Ambien was the first one to be approved, but the side effects of Ambien are pretty concerning and include drowsiness, nausea, dizziness, nightmares, amnesia, and agitation. And there have been reports of people getting up in the middle of the night and doing all kinds of strange things and not remembering it the next day. Lunesta is a non-benzo hypnotic. It's a drug that causes serious side effects, which include headache, dizziness, cough, hoarseness, fever or chills, sleepiness, drowsiness, heartburn, dry mouth, abnormal dreams, heavy menstrual bleeding for women, diarrhea, rash, and vomiting. Other than that, it's great. Have you noticed how many of these drugs have as a side effect drowsiness and sleepiness? And my gosh, that's what you're trying to get away from. That's a byproduct of insomnia. Antidepressants and barbiturates are also used, off-label by the way, for insomnia. They also have unpleasant side effects. Now, the side effects of the drugs are concerning. But what is even more concerning is their efficacy is really not that great. So let's take Lunesta, for example. Data from the longest running study of Lunesta showed that taking the drug allowed people to fall asleep 15 minutes faster and sleep 37 minutes longer. Now, to just put that in perspective, the subjects in the study still met the criteria for insomnia. They were sleeping 6.5 hours per night, and they were still taking 30 minutes to fall asleep. And then, of course, the side effects of Lunesta include sleepiness and drowsiness. What you're trying to get away from by taking the drugs is sleepiness and drowsiness, because that's a byproduct of insomnia, as I mentioned earlier. Now, a lot of people want to avoid the drugs, and for them, a supplement called melatonin is recommended. Melatonin is a hormone that is secreted in response to the circadian cycle. In supplement form, it's actually relatively safe, and for most people it doesn't cause a lot of side effects, and it's not addictive. One meta-analysis showed that melatonin had a minimal effect, helping insomniacs to get to sleep about 7.2 minutes sooner. I mean, that really is a minimal effect. Another research group conducted a meta-analysis and reported that melatonin was effective. The problem is the definition of effective is really subjective, because this meta-analysis showed that patients taking melatonin fell asleep 7 minutes earlier and slept 8 minutes longer. I mean, that's really not much. I don't think it really solves the insomnia problem. Still, another review conducted by the Agency for Healthcare Research and Quality concluded that while melatonin is relatively safe, and I'll just give you some data on the side effects. Nausea, the incidence is 1.5%. Headache, 7.8%, dizziness, 4%, drowsiness, 20.33%. And of course, that's again what we're trying to get away from. For short-term use, it's really not effective in treating most sleep disorders and doesn't help to alleviate either jet lag or shift work disorder. So basically, the supplements and the drugs, not so effective, some side effects, and even with melatonin, for 20% of the population, the side effect of the drug is the same as the side effect of the supplement, I should say, is the same as the side effect of insomnia, which is drowsiness. So as a result of this, the American College of Physicians recommends cognitive behavioral therapy, or CBT, as a first-line treatment for insomnia, combined with interventions such as sleep restriction and stimulus control. CBT for insomnia typically involves 6 to 8 sessions, during which patients learn new skills and habits, such as changing sleep schedules and modifying their beliefs about sleep. CBT resolves chronic sleep issues and insomnia in 70 to 80% of patients, almost always without the use of any medication. Now, in spite of its efficacy rate, the ACP authors identified several obstacles to CBT becoming adopted as a first line of treatment. And those include physician bias against psychological or behavioral approaches, and also that so few providers have actually been trained in CBT. It's really not taught in psychology or social work school as a preferred method of therapy, although I think a lot of us would argue that it should be. They wrote, quote, "The first step in implementing the new ACP guidelines is for physicians to recognize that a psychological alternative to pharmacologic therapy will accomplish better and safer patient outcomes." The ACP recommendations were based on 2 reviews published in the Annals of Internal Medicine. One group analyzed data from 35 randomized controlled trials and 11 long-term observational trials on drug treatment for insomnia. And this massive review showed about the same thing that I related to you earlier. Benzos, hypnotics, melatonin, antidepressants, other medications really don't help insomniacs that much. The other group reviewed 60 randomized controlled trials which assessed the benefits and harms of psychological and behavioral treatments for insomnia. One of the researchers reported that, quote, "There is insufficient evidence overall on the comparative effectiveness and safety of the various pharmacologic treatments." Not surprising. The group pointed out that data from the FDA showed that there are significant side effects from drugs commonly used to treat insomnia, which include an even longer list than the one I gave you earlier: dementia, fractures, major injury, inability to drive, negative cognitive and behavioral changes. On the other hand, behavioral intervention, cognitive therapy, led to improved remission, treatment response, sleep onset latency, wake after sleep onset, sleep efficiency, and sleep quality in the general population. And there were no negative side effects. In other words, retraining people, sleep retraining, which is part of cognitive therapy, there are no negative side effects, except some people report increasing fatigue before they finally get better. Sleep habits are actually learned through years of practice, and here's why that's good news. If you learned your sleep habits, you can relearn new sleep habits. Some sleep habits go all the way back to childhood, so you've had literally decades of time to practice poor sleeping habits. But again, the goal of cognitive therapy is to teach you how to relearn your sleep habits so that you can fall asleep easily, sleep through the night, and wake up feeling refreshed. It's a much better alternative, considerably more effective, and also incredibly more safe than taking drugs. All right, that is all for today. As usual, pass this on to anybody who you think might enjoy watching it, and I will be back to you next week with more news.